afternoon, everyone. COVID-19 is undoubtedly one of the most severe health crises we've ever faced, and the daily reports across the news channels and the climbing death toll is a sober reminder to all of us of the seriousness of the issues posed by this virus. It is not just a health issue, but this virus is also delivering a massive shock to the local economy. Over the past few weeks, we have seen unprecedented action from our national government, action that may be radical, but action that is entirely necessary if we are to see off the challenge of COVID-19 and emerge on the other side. I hope that people do recognise in this very turbulent environment that help is at hand, and we are starting to see it reach those that need it most. Since the grant scheme went live last Friday, 10,000 small businesses have already received financial assistance through the 10K grant scheme. As of today, a further 3,200 are being processed. So in the first week since the launch of the scheme, we have processed claims for around half of those eligible companies. That represents over 100 million that has already been paid out to small businesses across Northern Ireland, and a further 170 million in grants that will be paid in the coming days. For those small business owners who have not yet received a payment but think they are eligible, I would encourage them to go on to NI Business Info and register today. We are now focusing on the 25,000 scheme, and this scheme will see grants to around 4,000 businesses in our beleaguered tourism, hospitality and retail sectors. We will be making further announcements on this next week, and I will be working with Executive College to ensure that this is out as soon as possible. Whilst good work is being made, and we are ahead of other regions of the United Kingdom, more work is required to ensure that support is delivered to businesses who need it. I would like to see the 2,500 businesses who benefit from industrial derating and have a rateable value below 15,000 to be supported. And I will urge Executive College to consider extending the rates relief scheme so that it is at least as generous as elsewhere in the United Kingdom. These are obviously decisions to be taken by the whole Executive and need to be considered alongside bids from other departments, but they are measures of huge significance to our local economy. The Job Retention Scheme is an unprecedented intervention in the Northern Ireland economy. Some 17,000 jobs have been notified to Invest NI as being furloughed, jobs that would have been lost altogether. This demonstrates the importance of the scheme for Northern Ireland. However, greater clarity is urgently needed from Treasury and HMRC around eligibility, and I have been working all week to ensure that information goes out without delay to employers. Again, the Coronavirus Business Interruption Loan Scheme is a valuable support tool, but many firms are finding it challenging to secure money. I spoke to the Chief Secretary to the Treasury, Steve Barclay, about this earlier this week, and I hope that the Chancellor's statement will clarify. For those who are self-employed, delay in payments and gaps for those who became self-employed in the last year are issues that need to be urgently addressed by central government. Whilst there are huge challenges in the economy right now, I'm also heartened by what our businesses are doing. More than 40 companies have volunteered to assist in providing support to various PPE requirements, and more than 30 companies in Northern Ireland have offered to participate in manufacturing consortia to make ventilators. This is being coordinated by Invest NI. In the first few weeks of the crisis, we saw an immediate impact on our tourism and hospitality sector, but now we are seeing challenges emerge in other areas of our economy. Northern Ireland is reliant on our air and sea connectivity, but with significant pressures on the aviation industry and on ferry companies, we have seen a dramatic reduction in connectivity. The haulage industry is under tremendous stress, with fewer return loads as a direct result of the impact on manufacturers in GB. So we need to move to ensure that domestic markets are protected. This week I spoke to Alex Sharma, the Secretary of State for Business, Grant Shapps, the Secretary of State for Transport, and the Chief Secretary to the Treasury, to remind them that strong transport links between GB and Northern Ireland are of vital importance to our economy and our supply chains, particularly our food supply chains. This morning I re-emphasised that point to the Secretary of State, Brandon Lewis. The past week has also seen a focus on worker safety. I make no apology for saying it. The safety of everyone in the workplace is a priority for us all. And I salute those who are on the front line and working in vital industries such as food manufacturing, retail and energy. But let me be clear again. Every employer has a duty to provide a safe workplace. If people can, they should work from home. But for those who cannot, the work environment should be safe and follow the health and safety and PHA guidelines. In response to recent concerns, I have convened the engagement forum some days ago, comprised of unions and business groups. It has met twice this week and is working towards providing collective advice on the measures required to provide safety of key workers of those businesses that remain open. Health and Safety Executive has experienced significant pressures dealing with high volumes of inquiries, up some 1,800%. And I will ensure that each and every one of these complaints is responded to. I am pleased that we are seeing, as a result of those efforts, greater efforts from companies to introduce measures, and the majority are complying with our requests. We have examples where production lines have been extended, break times staggered, canteen tables restricted to one person per week, increased cleaning and physical measures such as perspex panels to minimise contact. Working with industry will save lives, and support and key messaging from industry, trade bodies and trade unions has all helped to ensure the workers in line with UK and PHA guidelines. We want to make sure that this good work continues, and we will do everything that is within our power to ensure that we have a safe workplace for those businesses that remain open. Before I finish, I want to pay my personal tribute to our frontline workers, our health and social care staff, but also frontline workers who are working day and night behind the scenes to keep food on our tables, our homes and our businesses heated and lit, and our economy moving. Thank you.
Thank you. Sadly and regrettably, we've seen more COVID-19 related deaths, bringing the number of fatalities here to 36 today. Our sympathies are extended to those grieving the loss of loved ones at this time. The message must go out loud and clear to the whole community to stay at home in order to stop the spread of this deadly virus and to protect lives and to take pressure off the health service. Most people are complying with this advice and the law, and while it's an anxious and stressful time for everyone, these measures are vital, as is social distancing. Yesterday, viewers heard from the Chief Scientific Officer, Professor Ian Young, on the recent modelling. According to the data, in the reasonable worst-case scenario, the health service here would have a realistic prospect of coping with the initial wave of COVID-19 cases. Under this scenario, with hospital admissions for COVID-19 running at a peak of 500 per week, it is estimated the peak number of those people whose lives would be lost would be 3,000 over 20 weeks. This is a very sobering statistic. Today we are joined by Chief Nursing Officer Charlotte McArdle, who will speak shortly. We expect to hit the peak number of cases between the 6th and 20th of April, and Belfast City Hospital has been transformed into our first Nightingale Hospital as part of the surge plans. This will become a 230-bed unit for critically ill patients, staffed by a team drawn from across the health service. I wish to say a few words on the acquisition of PPE. £140 million already has been supplied to the Department of Health for COVID-19 measures, including the purchase of tests. I have been working closely with the Health Minister to procure PPE and other supplies based on the needs identified by them, and we are pursuing leads with both the Irish and British governments. The scale of the pandemic we face means this will necessitate multiple orders containing a range of products from a variety of suppliers. We are sourcing the market for supplies locally, nationally and internationally in places like China. There is clearly a global demand for these goods and equipment. We are ramping up supply from local companies, including those that have repurposed their businesses to help in the fight against the virus. We must protect frontline workers in this fast-changing and challenging time. We will provide further updates as the supplies arrive, and the PPE and testing must be ramped up without further delay. Charlotte.
Thank you. Good afternoon. The Department of Health has today designated the Belfast City Hospital Tower Block as Northern Ireland's first Nightingale hospital for the anticipated surge of COVID-19 ahead of us during the month of April. This will provide intensive care for us as we move forward in the weeks ahead. It will be a 230-bed facility staffed by a team drawn from across Northern Ireland. Surge plans also include the development of further critical care facilities across Altnagelvin in the northwest and the Ulster Hospital sites as part of a phased approach to the surge plan. This will enable us to provide care for the sickest of our population during this surge of the pandemic by bringing together our most skilled resources into one site so we can maximise our capacity to do so. Establishing this Nightingale facility will also require significant temporary reconstruction and reconfiguration of existing critical care provision across the hospital network. Work is in train to make the necessary infrastructure alterations within the tower block itself. It will also be necessary for a proportion of non-COVID patients to have their care provided elsewhere and off the tower block site. This is in process at the moment. The Department is continuing to assess the potential of other facilities such as the Icon Centre at Balmoral Park, the previous Maze site, as a second Nightingale facility should we require it, potentially for later in the year, and preparations are underway to further investigate that. The Department can also confirm that the Northern Ireland Health System has now increased its ventilator total to 165, and further orders have been placed and are actively being progressed. The surge planning has been informed by the COVID-19 modelling, as Minister Murphy has just referred to. I want to take a moment to say a very big thank you to all of the staff in the Health and Social Care system for their responsiveness to this plan. In order to make this work, it is very logistically complicated. It requires the assistance of all trusts and indeed the Northern Ireland Ambulance Service, which will be faced with particularly difficult jobs over the next few weeks. And it is only with the support of our staff that we will be able to action this plan within the next week. The most important thing, I think, to remember is that the surge plan is based on 66% of the population adhering to social distancing. And social distancing will make the difference between the health service being able to deliver on this plan and not in the coming weeks. So I'm urging everyone to adhere to those guidance, to remain at home if possible, to protect themselves and their families, and to provide support to the healthcare by enabling them to provide the best possible care. Thank you.
Diane, this is primarily a question for you, but Conor, I would appreciate your reaction to it as well. Diane, you may be aware of a DUP councillor has been quoted in recent days essentially claiming that the coronavirus outbreak is God's judgment in respect of the implementation of abortion regime here in Northern Ireland, and also the legalisation of same-sex marriage. Could I first of all get your reaction to those comments? And secondly, could you confirm whether there is any disciplinary action or whether the councillor still enjoys the party role?
Well, first of all, can I say that those are entirely personal views of Mr. Carson. They are certainly not the views of the DUP, and they do not reflect the views of the vast majority of people. In fact, they are a bit of a distraction from what we all need to do and what you've heard today from Charlotte, which is the very, very serious challenges of fighting against COVID-19. And I would just maybe we should place on record our thanks to the churches and to those people who have faith for all that they have done as well in reaching out to the lonely, in reaching out to those who are isolated, in working in food banks. I believe that we have a God of love and mercy. And I think that's where most people will take comfort. And I think that all faith communities in Northern Ireland have been working incredibly hard in challenging and very, very difficult circumstances.
I'm sorry, can I just confirm whether there's any action being taken against the councillor?
Well, of course, that will go to party officers. I just heard about it about an hour ago before I came in here, so I'm presuming it will go to party officers. It certainly does not reflect the views of the DUP.
Stephen Walker.
No sound.
We're not hearing him.
No, we've lost you.
Go on to Tracy McGee.
Hello?
Oh, we're hearing you now.
Yep. Ministers, in light of reports today that some PPE equipment was turned back, can you address public concerns about a number of things? When will testing reach 1,100 cases a day as promised? And when will we have enough PPE and ventilators?
Well, can I say that part of sourcing PPE across the world, I've learned an awful lot about this in the last 2 weeks, is to ensure that it meets the standard required. And clearly, there is now a huge scramble globally across the world to try and secure adequate supplies of PPE, but also PPE that makes that standard. So we have a responsibility to ensure that, and that's why we're working through, in terms of our international attempt to get PPE, IDA and InvestNI officials on the ground in China to ensure they are aware of what we require, how much we require, and that it meets the standards that we require. So that's the approach that we're taking. That's incredibly challenged. It's even more challenged in recent days, as we predicted, as the United States and India woke up to the catastrophe that is facing those countries. They have now become very much involved in the market for PPE, and their economic power then can overshadow countries like ourselves in terms of trying to acquire that PPE. So those are challenges, but nonetheless, those are challenges that we're working on every single day with my own procurement team, with the health department, with the Irish government, and with our people that are on the ground in China. In terms of the acquisition from Britain, because there is a PPE supply there, we are working daily, and we hope to have some of that supply coming across in the next number of days to us. Again, based on what our requirements are. The health service here have told us they have sufficient stock. We need to ensure that sufficient stock makes its way to the front line where it's required. There are other services outside of health that require PPE. We have to make sure that they're supplied also. And so we hope to have that as soon as humanly possible.
And the Chief Medical Officer, Chief Nursing Officer, your response to that?
So we have sufficient stock at the moment. There are supply issues with some particular brands, and staff are amending their testing to accompany those particular brands. The ship that was turned back, we understand it was called back. We don't understand why as yet. But every effort is being made across government, led by the Department of Health, in relation to making sure that we have appropriate protection for our staff. Our staff need that protection, and certainly from a supplies point of view, now that we have identified a 230-bed unit on the Tower block, we will be looking to make sure that the supply is directed to our staff.
And Minister Dodds?
Well, it is absolutely imperative that we get the correct PPP to the correct places, and I understand that that kind of distribution has been a bit of a challenge over the last number of days. Again, I raised once again with the Secretary of State this morning the importance of access to that whole United Kingdom supply, and that comes to us quickly and without delay. We want to see both testing and appropriate PPE and protection for those who are working in the front line. And that is a priority for all of us right across government.
Good afternoon, everybody. Are you hearing me okay?
Yep.
Yes.
Just picking up something from the Health Committee today about testing. Cathy Jack, in her testimony to the Health Committee today, said that 10% of staff in the Belfast Trust are isolating 2,000 members of staff, 790 because they had symptoms, but 1,200 because members of their family are displaying symptoms. So I suppose the question would be to the Chief Nursing Officer, does that not underline the fact that we need to have more testing as soon as possible? And also then questions to the ministers about the supply chain, as you were saying, Minister Dodds, about getting these tests through, and also about procurement, especially given the fact that that same Health Committee heard that the tests are actually being made in Randox, but are now being shipped via Westminster. Does that not show that there are problems in terms of the supply chain?
In relation to the testing of our staff, they are absolutely a priority, along with the most sickest patients of COVID-19. We are ramping up testing on a daily basis, and a number of our staff have been tested, and work is ongoing, as Minister Murphy has previously said, across departments. This is a priority for everyone, including the Department of Health, and we will be ramping them up as soon as possible.
Tracy, can I just say again, I spoke with the Secretary of State with this morning, and I understand that Randox in particular are one of a number of companies in a consortia that are supplying the tests throughout the United Kingdom, and that we will get our share of those tests. And of course, we will not stop there. We are happy to cooperate with our neighbours in the Republic of Ireland and with other countries to ensure that testing is appropriate and as extensive as we can make it. You rightly referred to those people who couldn't go to work, and we need to make sure for our health service and our frontline health workers going forward that there is access to testing, that it is ramped up as quickly as possible, and that we have appropriate shares, and that we can do everything that we can, given the challenges we face, to get those tests.
Can I say it's no secret that I believe that we should have been testing much more and much sooner than we are. I'm glad that is being ramped up now, and I look forward to that being done very quickly. We have, in relation to PPE, as well as taking the supply that has come through NHS in England and trying to secure some supply from that which we hope in the coming days. But we've also, as a regional authority and having our own autonomy, reached out to procure supplies from elsewhere. And I think in relation to testing, it doesn't seem to me to be logical that we have a company 10 miles from here making tests, and the proposition is then to ship those to England and redistribute them back to us. So I think we need to ensure that we can secure sufficient tests for our purposes. I think we need to continue to ramp that up. The first and primary focus of that is to protect health service workers, to ensure that health service workers can return as quickly to the front line, because the modelling that we talked about, it was talked about yesterday and we referred to today, will only work if we have health service staff to cope with the demands that are going to be placed on them. They can't be there if they're isolating because they're assuming that they may or may not have COVID-19. So that needs to happen very quickly. We're late to the game in relation to this. We need to very quickly speed ourselves up and catch up.
Can I ask when the remaining COVID money is expected to be allocated, and also ask the Chief Nursing Officer, can she give assurances that all frontline nursing staff working at the new Nightingale Hospital will be given not just PPE but appropriate PPE?
Well, can I say in relation to, we've received about 920 million of COVID-19 related support from Westminster. Quite a lot of that was distributed fairly quickly through business support. A sizable chunk to the health service. I think we've over 600 million of it allocated. We have asked departments to come forward with, and we'll be assessing those bids today in relation to COVID-specific requests for spending in their own departments. We'll make a call on that, I'd say, on Monday's executive to get the rest of that money out. Of course, it would be prudent for us to hold some in reserve, because none of us are certain of how these challenges will unfold and where in particular they might arise. The first priority for the executive is to protect life and the health of our citizens, so we need to ensure that health is adequately provided for, and of course then we've tried to support the economy as well. So we're allocating that, but we expect, and we have talked to Treasury about this, we expect there to be further allocations, further interventions, and we will get that money and spend it as quickly as we can in the areas that need it the most.
In relation to staff in the tower block, I can confirm that it will be appropriate for every member of staff, not just the nursing staff, working closely with patients to have appropriate PPE, which in this case is full PPE. That means that they will not be able to even take a drink, so it is uncomfortable for them to wear, but they have to wear it in order to support themselves and the family, and it is a key priority for us to make sure that that PPE is in place.
Okay, that's it, folks.
Okay. I thought we were having a Channel 4. No?